Welcome to A Voice and Beyond. We have a very special guest here. We have Joshua DeTillio. How are you?
Good. Thanks for having me, Dr. Naismith. Great to be here.
Oh, you can call me Marissa.
Okay, Marissa.
Thank you. You know, I love how people from the US are so respectful of titles. Here in Australia, we're really casual about anyone's achievements. But in the US, I always feel that I'm very special or that I feel that I've worked hard for my title because I'm addressed by that. It's really good to see, actually.
No, we love our doctors here. So if you've earned that title, then we want to use it.
Yes, no, I really appreciate that. So, Joshua, it's about you. You are the Chief Administrative Officer at Gulf Coast Medical Center and an adjunct professor at Florida Gulf Coast University. You're also a fellow with the American College of Healthcare Executives. Now, you have quite an interesting history because you attended the US Military Academy and served in the Army for 5 years. You received a master's degree in business admin and public health, the health from Vanderbilt and Harvard, and you're certified in plant-based nutrition through Cornell. Okay, I'm thoroughly exhausted just trying to get through all of that. That is so many achievements in such a variety of fields. Tell us about your story and what made you transition through all these different types of learnings.
Well, no, thank you. And it's making me feel old. It seems like I've done a lot. And
You
I'm
have.
getting up there. So yeah. No, I started, like you said, in the Army after graduating West Point and really enjoyed that. But I wanted to be after I got out of the Army, I wanted to continue to be a leader, and I had a big passion for health and wellness as well. And so I learned about healthcare and hospital administration, and went back to school, got my business degree, and then got into hospitals after that. And then I went back and got a public health degree from Harvard because I wanted to be more clinical. I knew the business side, but I wanted to get a little bit of the clinical side as well. So that's kind of why I went through that path.
Yes, but was there an inspiration for that? Was there something in your life that triggered you to going into healthcare? Did you have healthcare concerns or did someone around you have those concerns?
Yeah, my why for going into healthcare went back to my grandparents. They both died a little young, one from cancer and one from Alzheimer's. And I didn't get to spend enough time with them as a kid. And so that really kind of got me thinking, how can we live longer, healthier lives? And that's what kind of piqued my interest in health and wellness and healthcare. And so that's why I got into the field.
Yes, and you're quite what's the word, like you're very proactive in your own health because you're a swimmer, you've competed in more than 50 triathlons, you meditate, you surf, you do yoga, tai chi and CrossFit. How do you fit all that in?
Well, I don't do all that in the same day or same
I hope
week.
not.
No, no, that's a
You'd
lot.
have superpowers.
When you say it like that, it's a lot. But I think I'm on the wrong continent because in Australia, your swimmers are
Mm.
your best athletes there and highly revered. So in my next life, I want to be a swimmer in Australia. But
Well,
no.
don't tell our football players that.
But no, I do like to stay in shape, and I do like to eat healthy, and
Mm.
I just feel better, and I have more energy, and I sleep better, and it's all connected. And then once you've kind of got the body, feeling good or better, then you want to work on the mental health as well too, and you want to do the meditation, and then once you've got the mind and the body going, then you kind of get into that spiritual piece too, and then everything's kind of clicking. So it all kind of feeds into each other and makes you feel good and makes you really enjoy life.
So you talk about the mental and the physical, and people forget about that because basically, our bodies are our temple, but also our the foods that we eat fuel our brains as well. It's a really holistic approach that we need to take to health. But what does good health, what defines that for you?
Well, for me, it's really the kind of optimal balance of one, feeling good, two, having the right amount of energy, and then three, really just, aging slowly and aging gracefully. We see in the United States that, once you hit 60 or 65, then you really start having a lot of health conditions or concerns and chronic disease, for a variety of factors. And so for me, working in a hospital, I know that I don't want to be in a hospital because it's a scary place. And so anything I can do to kind of prevent any health issues is something I'm very excited about, and do that through various things, staying active, good nutrition, and your doctor will tell you the same thing. The best medicine is good diet and exercise, right?
Mm. So it's prevention rather than cure. But why are most people failing when it comes to health and longevity? Like the average person, where are they getting it all wrong?
Well, I mean, there's a couple issues, and I haven't been to Australia yet, but the food in the United States is challenging at this point. There's a lot of processed food. There's a lot of corruption of the food, and so it's very difficult to stay healthy. And there's also a lack of nutrients in our fruits and vegetables as well too. So we end up overeating here, and that leads to a lot of the chronic disease. It leads to the obesity and the cardiac disease and the diabetes, which, as you know, I mean, just leads into a host of other health related issues. And so I'm not sure if the food is a little bit more healthy in Australia, but that's one of the big
Mm.
challenges here in the United States.
I do come to the US at least once or twice a year. And the last time I was there, and first up, what I have noticed over there is the portions are larger than what
Yes.
we have here. And there's fries with just about everything.
Yes. We love fries.
Yeah, so do I, but I actually stopped eating fries. That's my weakness. But a few months ago, I was diagnosed with minor COPD. And
Mhm.
so I decided that I would start eating a low inflammatory or non-inflammatory
Mhm.
diet, cutting out processed foods and making some different lifestyle choices, even though I'm fit and active and I go to the gym and I walk, but I decided that I would up the ante when it came to cardio and anything building lung capacity.
Mhm.
Instead of parking close to the train, and I make sure now I pick the car park that's the furthest away, so I
Mhm.
have to walk that little bit further. One of the
Yes.
things I did, and this is, as I said, my one of my biggest weaknesses is fries. I decided to cut those out.
Wow.
And you know what? I haven't eaten a fry now for about 4 months, and we'll go out for dinner. And my husband's the opposite. He eats burgers and fries, and I don't want to be rude, but he looks like he eats burgers and fries compared to me. And I don't touch a one. It's so, and I've never missed it. I don't know if
How
we,
has your health improved, and has the inflammation gone down?
absolutely. I couldn't make it up a flight of stairs. I thought I had long
That's
COVID.
amazing.
I did. I actually thought I had long COVID, but of course the COVID would have exacerbated the
Mhm.
COPD. And not knowing that I had that condition, and I only found out by accident. And I've told this story that I ended up at the doctor's by mistake one day. I thought I was due for one of my usual tests, like one of the female tests that we have
Mhm.
every few years, but I was
Yes.
there too early because they changed it now that it's every 5 years instead of every two. And
Oh.
and when I got there, the doctor said, "Well, you're here now, so let's have a chat," and asked me what had been going on. And my mum had just recently passed away. She was 99, but
Mm.
she had heart problems from her late 80s. And so they asked me about that and what were the heart issues that she had, and I said she had blockages. They asked, did she have high cholesterol? I said yes. They said,
Mhm.
let's check you out for cholesterol. You don't look like you have a cholesterol problem, but let's see, sometimes it can be genetic. So had the test, I have high cholesterol.
Yeah.
And I said, now I'm not going to take the medication. I refuse to take the medication, but I do know that there's a test I can have that will give me my risk factor for
Mhm.
heart problems, heart disease, heart attack.
Yes.
And she didn't even suggest that. She was just going to medicate me. And
Yeah.
I'd only heard about this through a friend. So I went and had the test, and the test came back that it was 0 chance of heart attack. She said,
That's good.
however, we've found that you have minor COPD. Now, I didn't know what that was, and she didn't really talk about it too much. She didn't make a big deal out of it.
Mm-hmm.
And then I came home and I looked it up and I thought I was going to die. Right. I just went, this is not good. And I think I spent the next 3 nights wide awake. I didn't get a wink of sleep, thinking
Yeah, it's scary.
this is really scary. And then I started to do a little bit more research, and I thought, well, everything comes back to inflammation.
It
And
does.
if I can take care of that aspect, then that's going to help me.
Mm-hmm.
So I started making all these little changes that all, in the grand scheme of
They add up.
life, mount up to one big change.
That's right.
I couldn't make it up a flight of stairs, but I never told anyone. But I was really struggling. And just slowly but surely, I am the fittest now that I've ever been in my life.
Oh, that's great.
So
Yeah, we found
by doing
on our journey, when people started eating healthier, our employees started eating healthier, in a matter of weeks or a month, they improved dramatically once you get that inflammation down. I mean, that's really the key.
it
And
is.
and your body will heal itself pretty quickly as long as you put the right things in it.
Yes. Well, I have felt such a change, and now it's been ongoing for a number of months. It's not that I felt
That's
well
great.
for a week. It's been consistent. And no, I'm feeling so well.
But unfortunately, like, and it's good that you're doing the podcast and getting the word out, but a lot of people, and I'm not saying you, but they don't really take action or start working on their health or prevention until they get a scare, until the doctor says, you've got XYZ. Then that's when they start taking it seriously. But they've got to start earlier on. They've got to start younger. They've got to really work on it every day.
But you can be doing the work as I did. I was exercising 4 times a week. I thought I was eating healthy until I
Mhm.
got the diagnosis, and I thought, no, I can do even better than this. And yes, you're right, it takes something to motivate us. But how do we get people started on this? I mean, I know people lack motivation, and people have all good intentions. New Year's Eve comes around, they set
Mhm.
their goal for the new year that they're going to lose weight. Where do they get it all wrong?
No, I mean, everyone gets it right. The problem is that the food is in general is very addictive, whether it's the salt, the sugar, or the fat. Once you start eating it, it's an endless cycle that you want more. And then again, they're not very nutrient dense foods, so you never really feel satiated, and you want to continue to eat more, and that's why you overeat, and that's why you gain weight, et cetera, et cetera. But what we found in our journey at the hospital, in our wellness program, really was that if the employees had some skin in the game, some financial skin in the game, we had a group therapy session where we would pay $300 and then they would pay $300, which gave them an incentive to actually work through the program. And then it was in a group of 20 people, so there were other friends in there, and they felt responsible to the group, to stick to the meal planning. And then we found that after a couple weeks, 2 weeks to 3 weeks, they started feeling so much better that they never really wanted to go back to the processed food and the fried food and all the sugar and the salt and all the stuff that we consume. So if you can get through it for a couple weeks, you do extremely better.
Yes, and you raise a good point there too, that with the foods. They are addictive. I heard that some of the foods that we eat, when it comes to sugars especially, that they can give you the same hit as cocaine does, you know,
Yeah.
and you have that addiction. And there's ingredients being put into our foods
Yes.
by these billion-dollar companies that we are unaware of to keep us eating these foods. And then you have the advertising that goes along with it as
Mhm.
well. You can't even go on YouTube without seeing what we've got, Burger King, or we've got Hungry Jack's, or whatever it is, McDonald's. They've all got their ads promoting
Mhm.
unhealthy food. But as a society, what's the greatest risk that we face at the moment? These people that come to you, to your healthcare program, what's the biggest issue that you're seeing currently amongst people? Is there one common thing?
Well, I mean, like I said, the biggest diseases that we're seeing are the cardiac disease, the diabetes, the obesity as well. I mean, that didn't really come to us for that, but that relates to a host of other issues. Um, so those are the big ones, and that's really what's impacting a lot of the elderly here. So those are the scariest ones.
Mm. I did notice when I was in the US that when I when I was eating there, that all the restaurants now have calories beside the food. Is that a law that came in, that it's mandatory to do that?
Um, I think in certain states it is a law.
Oh,
I'm
this
not
was
familiar with.
New York. New York
Yeah,
and Philadelphia.
yeah, some of those northeastern states probably do have laws that mandate that.
Okay. But what was really what, what was really interesting was that the steak and the fries had the same calories as a salad.
That's interesting. That is interesting. Yeah, I mean, some of the salads in the United States are, just loaded with oil and dressing and all kinds of other sides that, are very unhealthy, right? So there's some healthy lettuce and some vegetables, but there's a lot of unhealthy things in our salads
Yes.
too.
And I didn't realize how many calories are in foods too.
Yeah.
Like I
There
was I was shocked.
some of the meals here are, 2,000, 2,500 calories. I mean, that's all you need for a day, right? I
I
mean,
was going to
so
say that's your daily intake.
yeah.
Oh my gosh. Okay, so at present you're working within the hospital and you have an essential how-to guide on building and maintaining your own wellness. So who are the people that you work with, and tell us about this plan?
Yeah, so this is a journey that we went on a couple hospitals ago that I worked at, where we really just kind of started early stage, and we really decided that we wanted to create a wellness program to really help our employees feel better. Because in the hospital, in healthcare, we're in a people business, people taking care of people. So if we've got engaged, healthy employees that are excited to come to work, we have better patient experience, right? They're taking better care of the patients. So we wanted to invest in them, and we started small. We had some of us that were role models, that were role modeling healthy lifestyles, and some other leaders that really role modeled. And that's what you need really in the beginning, is a lot of good leadership that's really committed. And then we just started trying different things, trying different things with the food, introducing new foods in the cafeteria, trying different exercise programs in the hospital, trying different group therapy sessions, as well as sponsoring different races in the local community, whether they were triathlons or 5Ks, and getting people out and getting people doing things. We also put in a meditation room at the hospital, so employees and doctors could go in there, for 5 minutes or an hour, and just kind of decompress, because healthcare is a very stressful job, and patients sometimes do well and sometimes they don't, and so that takes a lot out of our caregivers. So the book really just kind of details the journey, kind of what we did, kind of step by step. And if you want to implement a wellness program at your company, this kind of gives you a guide and kind of a roadmap to do that.
Yes, well, we haven't given the book a title yet. We haven't got to the book yet, but tell us the name of the book.
Yeah, the book is called Healthy You, Healthy Team, Healthy Company. And it's called that because, again, it starts with you. You're the only one that can make a change in yourself and people aren't going to follow you unless, you role model, and you are that lighthouse. And once you are that lighthouse, people will come to you and say, hey, what are you doing? And that's what we found too. Once some of our employees started losing weight, and that's the big one, right? When people start losing weight, people ask a lot of questions. Hey, what are you doing? I want to do that too. So that's how it kind of works. And then it kind of builds from there and then grows into the entire company is really committed to health and wellness.
And I like the concept of what you're talking about there in terms of role modeling. And there's so many layers to that, because you talk about, as healthcare workers, that you are actually the role models. And where I go to the doctor, in that surgery, there's probably about 12 doctors, and I've never seen a more unhealthy group of people in my life. They're overweight. A few of them go outside and smoke. And I just go, you're the doctor here. How can you expect your patients to take care of themselves if you don't? And even you're talking about business leaders. I mean, everything starts at the top, I believe. And then there's the family unit with parents. As parents, I think we need to role model for our children as well. And that's where a lot of the problems start too, is in the household, in the way that we're raised and the foods that we're introduced to. So you talk about...
Yeah, that's why and that's a great point. And I wrote about that in the book, that healthcare workers are some of the most unhealthy. And there's a couple of reasons for that. One is because they're essentially, they're givers, right? They give all of themselves to their patients, and they take care of themselves second. And they're also very busy people, and so they're eating on the run. And if you've ever been in a hospital for a long period of time, you see there's a lot of unhealthy food. There's donuts, there's cookies, there's all kinds of stuff all the time, and they're just grabbing and eating them. So I mean, for those reasons, they're unhealthy. But again, that's why we wanted him to go on this journey and do this wellness plan to really help our team.
Yes. And also too, if you're in that hospital system, it's all the shift work too. That must really mess with metabolism.
It does. It does when you're on a 12-hour shift or when you're on an overnight shift. It's very difficult. Yeah, and again, healthcare is a stressful job too, so there's a lot of stress eating as well.
Yes. And once again, stress and anxiety, that exacerbates inflammation.
Exactly.
See, we know all the answers. Yes. And you talk about the 8 stages that you work through with your clients. What are those 8 stages, and why is each of them so important?
Oh, wow. You're quizzing me now. So one is the first one is, again, the role modeling. It starts with you. Second one is getting, that leadership cohort, getting the leaders at the top to buy in. The next one really is getting the financial incentives, trying to, get some skin in the game with the team. One of the next ones is food. I mean, that's an entire chapter talking about that. Another chapter is the exercise. Another chapter is the team dynamic, and really getting people to become mentors to each other and to rely on each other, and and set up settings where they can talk to each other and see what's working and what's not. And then we get into the data piece. We collected a lot of data and try and understand trends and see who was high risk for disease or issues, and trying to intervene with them early on. And then one of the last ones is just financial incentives with the insurance and insurance companies, potential bonuses or things of that nature, again to incentivize our team to be healthier and live healthier lives.
I'd like to touch on just quickly where we'll go back to that business model, but for people who are not working in a business, other than, like, there's a lot of voice teachers that are listening to this, when there's a chapter, you said a whole chapter on food. If you had to say what was the worst food you can eat and something you would really encourage people to eat, something to, or a piece of advice relating to nutrition, what would that be?
Well, I'm not a doctor, so I'm not an expert. But what we saw, and in our journey, and in my own personal experience, really, I think the dairy is really the most challenging food. Um, the dairy, really is for baby cows. It's not really for human consumption, and that leads to a significant amount of inflammation in the body, and can help cause a whole host of diseases. So whether that's the milk, the cheese, the ice cream, um, yogurt, things like that are really some of the worst. And you mentioned earlier that that some of the foods light up your brain, but dairy is the one that lights up those dopamine receptors in your brain, which again makes you crave more of it. So especially ice cream, if you've got the dairy combined with the sugar, it's just like it's an amazing thing, right? Everyone loves ice cream, but again, not very healthy for you.
That's interesting because most women, when they have a bad breakup, go and buy a tub of ice cream.
Well, I'm not saying not to do that,
No.
but again, it's everything in moderation too, right? I mean, everyone loves ice cream, but you don't have to eat it every day, right?
Mm. So if someone wanted to start taking better care of their health in terms of nutrition, what would be a good place to start? Would it be to alleviate dairy?
Well, I think, and again, I'm not a doctor, but I think
Yes.
it's just going back to what our grandmothers told us, what our parents told us: eat more fruits and vegetables, right? So if we can eat a lot more fruits and vegetables and less of the other things, we're going to be a lot healthier. And when you do eat lots of fruits and vegetables, you're not as hungry for the processed foods and some of those other foods. So that would be my advice: just eat more fruits and vegetables.
Yes. And when it comes to exercise, where can people start? What would you, I know you're not a doctor, and that's fine. We've made that disclaimer, but just through your own experience and what you've seen in terms of how this plan has worked for other people, what
Mhm.
would you suggest to someone who doesn't, I don't use the word exercise because I believe a lot of people are allergic to that word. I call it physical activity.
Yeah,
So
physical activity.
where would you suggest people start?
Well, I think people should start wherever they can. If their first thing is just to walk down the block, then they should walk down the block. If it's to walk 2 miles, they should do that. If they're ready for a 5K, then they should do that. We had an employee, I won't tell you his name, but he really was severely overweight, and he really couldn't walk more than 20 paces without getting out of breath,
Mhm.
and was just not in good shape at all. And I'll tell you the journey that he went on. He lost about 75 pounds, and he was doing Ironman triathlons,
Wow.
10, 11-hour races, in about a year. So anything can be done. I would say, again, start small, consult your doctor. You don't want to overdo it, right? But just it, as you know, in your exercise, I mean, you get started, and then you get stronger, and then you feel better, and then you do a little bit more every day. So start where you're at and just keep trying to improve.
I don't, I know when I first started this intense cardio work that I do now, I remember saying to the trainer, this was doing reformer Pilates, but it was really intense.
Uh-huh.
And I said, I don't know if I want to pass out or projectile vomit right now. And she looked
Yeah.
at me, it was like,
Well,
is she,
that's how you're working hard, when you feel like that. You've definitely done a good workout then.
yeah. But then you get to a point where you get past the threshold and you're
Mhm.
fine. And I've learned that. It's like, don't panic. You're going to get past this and it's all's going to be well.
And
But
then you come back the next day stronger, and you're able to do it
yes,
much easier. Yep.
yes, yes. And I'm in a class with people that are at least 20, 30 years younger than me. And most of them are professional dancers. and
Oh, wow.
I wipe all of them.
Wow, that's great.
I smash all of them.
That's
So, and I
excellent.
can say that proudly, and there's no ego in there, it's fact. But so, what I was going to say too, I love the idea that you endorse just starting small, because I think most people get that wrong, and that's what leads them down that path of failure or not being able to keep things up because they set their goals too big and
Mhm.
they're unattainable, and then they feel like they just can't achieve the goal and they throw the towel in and
They
go
get
back.
frustrated and quit. Yep.
Exactly,
Mhm.
exactly. So I think that is really, really important. So in terms of this employee and employer and working with businesses, what are the benefits you've seen for companies that have taken on this program, and how's it helped them and their employees?
Yeah, I mean, this is the most important piece for the companies, really, is it's an investment in your team. Yeah, there's some financial investment, but what you get back is so much more rewarding. You get that extra engagement, you get that extra productivity, as well as, since COVID especially, the competition for talent for the best people has really increased a lot. And
Mm,
again, being in the people business, you want to have the best people. And especially the younger generation, they want to work for a company that really cares about them, that they're not just a number, right? And if a company is willing to invest in your wellness, in your health, then they're going to be much more willing to give more of themselves to that company and their patients, or whatever industry you're in. So it's really a win-win-win, when the company invests in you as an employee.
yes, I was going to say there's benefits all round. You have a healthier team physically, mentally, and emotionally, because
Mhm.
let's not forget about those feel good endorphins when you
Mhm.
exercise, and then just the general improved health by eating better food. And then people aren't going to need to have so much time off if they're well, and that
It's
leads
true.
to financial gain.
Well, we talked about that in the book a little bit too. There is financial gain, especially because the most expensive things on the health insurance and the healthcare are, those hospitalizations, those surgeries, those long-term care. And that's really only about 5% of the population that contributes to
Mm.
about 90% of the insurance bill. So all of us that are paying for health insurance are paying for those 5% that are really sick, that are in the hospital, that are getting surgery and in long-term care. So if you can reduce some of those and keep those people healthier, your insurance bills will go down as well.
Yes. And with this program, who goes in and implements it, and how do they do that?
It starts at the top. It's got to be the leader of the organization. They have to champion it, and they have to own it, and they have to live that lifestyle. Otherwise, it won't work, because everyone will look at that person and say, "Oh, well, that person's not doing it, and why should I do it?" Right? So that's
Yes.
where it starts, at the top.
Yes. But does someone go into that workplace and implement the plan, or how does that leader educate themselves about the plan and the program?
Well, I mean, that's why I wrote the book. Really, again, it gives you kind of a guide and a roadmap to implement that plan. Also, if I can help you in any way, you can always, call me or email me, and help you implement as well. But it's really a lot of trial and error as well too. Hopefully, with the book now, there's less error in some of the mistakes that we made, um, and hopefully they don't have to make those mistakes. But yeah, the book really gives that detailed approach.
Excellent. So, what are you working on now?
Well, in terms of, I'm actually working on a leadership book. Actually, that's going to be my next book. I've been a leader a long time, and I've got some lessons learned. Again, a lot of trial and error there, and so I want to kind of document some of the things that I've learned in the leadership space.
Yes. Is there anything else that you wanted to add to this interview that perhaps we've overlooked?
No, nothing else. I just, I want to continue to get the word out on health and wellness, and the two most important things in life are health and family. And I would argue that health is even more important than family, because if you don't have your health, then you won't have your family. And so, everyone's got to really focus there on their health, and it's
Mm.
something they've got to do every day. You can't just wait until you're 55 and you're getting open heart surgery. You got to start now.
Oh, 100%. Yes, because we can all take it for granted. And then all of a sudden you get a diagnosis that's left of field, and you didn't see that one coming, even though you thought you were doing all the best things that
Yes.
you could. And like for me, with the COPD, I've never smoked a cigarette in my life, but I was a professional entertainer for 35 years back in the days where there was cigarette smoke in all the
Ah,
venues.
yes. Hmm.
So from secondary smoking. And
Secondhand. Yeah.
yes, and I've been married to two smokers.
Yeah. Secondhand smoke, just as
I should
bad.
sue my husband, actually. Do you think that would
No,
stand up in
you're
a
not
court
allowed
of
to do that.
law?
You can't do that in the United States. You can't sue your husband. So
Oh, really?
no, I'm just kidding.
Can I divorce him and then sue him and then
You can
remarry
probably
him?
do that. Yeah. I'm not a lawyer either, so I don't know.
Okay, so we're going to wrap this up, and I'd like you to perhaps, if you had to give us one piece of advice you'd like to give our listeners as to how they can improve their health.
No, again, just focus on yourself. No one can make the changes for you. You've got to want to do it for all the right reasons, and just get started.
Yes, that is the thing, isn't it? That's the
It's
thing.
hard to get started.
But I think to get started, you've got to have a plan.
Yes.
Yeah,
Yes,
you
I
just have,
agree.
yeah.
I agree because again, like we talked about, we're really addicted to these foods, and if you can't get past that first week or week and a half to kind of detox all that bad stuff out, then you go right back into that loop, into
Mhm,
that cycle. So you got to really stick with it for a few weeks, and then you feel better, and then you don't want to go back.
mhm. And then when it comes to exercise, my advice would be schedule it
Yes, I
and
agree.
stick with it. Yeah, yeah.
And group workouts are good too, right? Because then
Mhm.
if you don't show up, everyone says, "Hey, Dr. Naismith, where were you? We missed you," and then you feel
Yeah.
bad. You want to, work out with them.
I divorced my husband and I was eating a tub of ice cream. That would be my excuse. No.
That's a good excuse.
No.
That's fair.
I hope my husband doesn't hear this. Well, thank you so much, Joshua. It's been a real treat having you on the show. We're going to share the link to your book and any other things that you would like to share with our listeners in the show notes, as always. And we wish you all the very best in the future, and good luck with your new book, and also good luck with the program that you're working on right now too. Hope it all goes really well and we start seeing a bunch of really healthy Americans. Well, not just Americans, people all around the world, because I tell you what, the Australians here, I think since COVID especially, a lot of people have dropped the ball on their health. So thank you so much, Joshua. Best wishes with everything. Thank you for taking the time to
Thanks,
be
Marissa.
here.
Thanks for having me.
Take care. Bye.
Bye.